Hey, BC here for BC Nephro. I'm Dr. Brian Cronin, a nephrologist and clinical specialist in hypertension. I'm going to talk about dialyzers, specifically dialysis membranes, the different types of membranes, the different techniques used to sterilize these membranes, and the different types of reactions that can be associated with the membrane types and the sterilization techniques. For more information, check out bcnephro.com. A link will be in the description below. So let's get into it. So I have a couple dialyzers here from local dialysis clinic. These are the common dialyzers you're likely to see both at your outpatient center and in the inpatient hospital unit. First here I have a Nipro Silentia dialyzer. Next I have a Revoclear 300. And then last, which is one of the most common dialyzers I see, is an Optiflux F180. Dialyzers contain an outer shell, and the dialysis membranes are hollow fibers inside this shell. The outer shell is composed of housing, which is this outer component, usually composed of polycarbonate or another material. The hollow fibers, dialysis fibers, are held in place by something called a potting substance, which is usually polyurethane, and the hollow tubules are all bathed in dialysate, the dialysis fluid, and the blood runs through these tubules, which are semi-permeable membranes for the exchange techniques. Now, these dialysis membranes, initially, the first generation was made of something called cellulose, which is a cotton derivative. Now, these membranes were what was referred to as bioincompatible, and that is when the blood was exposed to this substance, there was an inflammatory reaction which activated complement. There could be a number of symptoms with this. It caused an acute transient neutropenia with pulmonary sequestration of the neutrophils, and there could be other associated reactions such as chest pain, back pain, dyspnea, or hypotension. Because of this, the dialysis membranes evolved to become more biocompatible. The next level was a modification of the cellulose, either a modification by adding something called acetate to the side chains, or by modifying the process of the cellulose with something called hemofane. Third generation is synthetic membranes, which are the most commonly used, and these are made of synthetic material, commonly polysulfone, other poly materials, PAN, PMMA, and these are the most biocompatible. Since the blood is exposed to these membranes, they need to be sterilized. There are a number of different sterilization techniques, including ethylene oxide, irradiation, most commonly gamma irradiation, EBCT, which is electron beam CT, sterilization, or sterilization with heat, which is referred to as steam. Now, there can be a number of different types of reactions that can be associated with different membranes and different sterilization techniques. The first reaction, which is the most severe, is a type A reaction. This is an allergic reaction. It can manifest as itching and hives, but can be more severe, progressive bronchospasm, hypotension, or even anaphylactic shock. These reactions happen very early in the dialysis treatment. Within the first few minutes, they say within 5 to 20 minutes. They have commonly been attributed to an allergic reaction to the ethylene oxide, a sterilant. There still may have been some residual of that when the dialyzer is first used. If someone has a type A reaction, because it's a severe allergic reaction, the dialysis treatment should be terminated immediately, and the blood that's in the dialysis circuit should not be returned to the patient, as returning this blood would aggravate the reaction and possibly anaphylaxis. The next type of reaction is referred to as a type B reaction. These reactions were the complement mediated and more likely to occur with the bioincompatible cellulose dialyzers. They occur still relatively early, but a little bit later, maybe 15 to 30 minutes. They're manifest as back pain and chest pain, can also have symptoms of dyspnea and hypotension, but they do not progress to anaphylaxis. And this reaction improves with ongoing dialysis, likely because the dialysis membranes are coated with plasma proteins, decreasing the severity of this inflammatory complement-mediated reaction. These was very common when the first generation cellulose dialyzers were used. They still can be seen with the more biocompatible polysulfone dialyzers. A couple other reactions that can be seen, one being thrombocytopenia. Like the decrease in neutrophils, there often can be a transient mild decrease in platelets during the dialysis session. This usually is mild and rebounds, but in some cases can be more severe. And this has been seen with the dialyzer sterilized by the EBCT technique, and particularly polysulfone dialyzers. So polysulfone apparently may have the ability to activate platelets, even though it's more biocompatible and supposedly doesn't activate complement. It seems difficult to sort it out because a lot of the polysulfone dialyzers are also sterilized by EBCT. Finally, patients with dialysis can get hypoxia during the dialysis treatment, which is a little bit counterintuitive because when you're removing fluid with dialysis, you think you would be relieving pulmonary congestion, helping hypoxia. Now, hypoxia is often attributed to comorbidities. Patients with coronary disease, COPD, the hemodynamic stress of dialysis may induce hypoxia. Likewise, obese patients with sleep apnea who are sleeping during the treatment may get hypoxia during treatment, but it can also be a manifestation of a dialyzer reaction with the pulmonary sequestration of neutrophils. So, what to do? If it's a type A reaction, you need to terminate the treatment immediately, do not return the blood to the patient, treat the allergic reaction as needed with antihistamines and steroids. For subsequent treatments, make sure you're using a dialyzer that is not sterilized by ethylene oxide and consider using a different type of membrane. For the type B reactions, likewise, you can, if you're using a bioincompatible membrane, try to use a more biocompatible membrane. And these patients may need to be treated with antihistamines. If it happens with a biocompatible membrane, you can try alternate dialyzers, maybe another synthetic material, or even a modified cellulose dialyzer, even though supposedly it is less biocompatible, more bioincompatible. Likewise, you can try the same techniques if someone has dialysis-induced hypoxia. Now, getting back to the dialyzers we have here, one of the common ones here, Optiflux F180. This is the dialysis membrane is polysulfone, a synthetic material. The sterilization technique is electron beam CT. So this is the type that may be associated with thrombocytopenia. The potting material at the top is polyurethane and the outer shell is polycarbonate. Next, we have the Revoclear 300. Again, this is another synthetic dialyzer made by a different poly material. It's a combination of polyether sulfone and polyvinyl pyridine. It is sterilized by steam, and again, the potting at the top is polyurethane and the outer shell is polycarbonate. The Nipro Silentia is a modified cellulose triacetate, and ironically, this is a dialyzer that's often used as an alternative if someone has a reaction to the polysulfone dialyzer. It is sterilized by gamma radiation, so if it was the electron beam CT component causing the thrombocytopenia, that may make sense. The shell for the housing, it is not polycarbonate, it is polypropylene, but the potting compound is also polyurethane. So that's it. Thanks for watching. Please share this video with someone who you think might benefit from the message, from the information. And if you made it this far, you might as well subscribe to the channel, like the video. It only takes you a few seconds, and it's doing things like this that helps me spread this information, get this information to more people. Until next time.